You're not just building a product, you're designing a system that will last. But if the foundation is cracked, no matter how sleek the design is, it won't last. What you cannot see, like the unaligned team, the non-functional operation, and the surface level compliance, is what's silently stalling your growth. The good news? Today we will talk about with the right support, you can reinforce the structure, realign your strategy, and scale with confidence. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Another exciting day at Vibe. Hi, George.
Another exciting day. Hi, how are you?
Good. Can't wait to have this amazing conversation. George Pappas from Health Catalyst.
Yes, and Enterprise Health.
Yes. So we always like to start with what got you, what's the gap? What's the really problem that got you here and why you create all this, fun stuff?
It's basically 30 years of accumulated technology and regulation and complexity has left our health system very vulnerable to cyberattacks. And healthcare data is very valuable. So you think about 330 million patient records surrounded by a big piece of Swiss cheese and a lot of mice trying to crawl through the holes. That's kind of where we are today.
Yeah, I love that. A lot of time we deal with people who are like myself, came from the clinical part, right? We're trained to just ask the patient what their symptoms and get to a diagnosis and then go forward. And scientists dive so deep into the cellular changes, how we're special, right? But when they are missing out is the example that you just gave. Cyberattack security issues is like that mice go around all the crevices and eating away the cheese, and how are we protected as a whole in the middle?
Yeah, and the way we got here was that we've had a healthcare system consuming software and platforms now for 30 years. And enterprise software systems anyway, on a good day, are kind of brittle. They have certain weaknesses and they have to be managed properly. But then add 20 years of M&A, buying systems. So if you bought another health system, you kind of bought their hidden vulnerabilities, not just the system itself, and they accumulate. And how many people after an acquisition want to go for the dirty sock drawer and straighten up? They don't. So those linger, right? And then you have to figure out, well, how do I track all this? How do I take stock of it? How do you decide what to fix first, second, third? It takes time and money. Because as we also know, and you know from being a clinician, healthcare reimbursement models are very challenging. So if you look at 5,000 hospitals in the United States, half of them are barely breaking even or losing money. So how are they going to have the resources and capacity to actually tackle this problem strategically? It's a really hard challenge.
Yeah. My alma mater from grad school, Hahnemann, closed. And that was years after I graduated, but still seeing a hospital that's been around for so many years and to be able to shut down despite all the student bodies who train there, and then being a local community hospital, it's also saddened to see that can happen to any skill sets of system. And it's not just a cybersecurity issue, it's management, as you're saying, right? It's the efficiency, do you know what you need to do? So then even from the basic foundation of any startup solution, when you come up, I think a lot of time we see struggle of why things cannot grow and scale is that they're simplifying that too much. Of we got this resource, we're just gonna do it now. But is that something that can take you even bigger, right? It's not just this one solution, it's something bigger impact than we can create. But those require the efficiency, the integration, the right tech to set up the foundation.
Right, and well, in fact, it's also a management issue, okay? Because ultimately, if you don't stay at it, right, you're not going to fix it overnight.
Yeah.
But it's a progressively improving issue if you invest in it. But because the economics are so challenging, you have leadership teams saying, well, we could spend $200,000 on fixing our identity management problem, or I could go buy a new, fill in the blank clinical machine that will help generate X, right? And so that's the trade-off where up until this year, even the last couple of years though it hit, the regulatory need, people would say, well, I can do the least amount possible and claim I'm being compliant. So that's sort of a way to hopefully protect yourself if you do get attacked. But then the problem is the risk is greater than the level of execution that you're operating to. And if you do get attacked and you're found to be negligent, your liability as a health system goes way up. The thing we haven't talked about that's actually more important is when you're down for weeks. So if you're serving an underserved population, where are they going for care, right? And just this past year was the first time we had some evidence that a cyber attack caused patient death because they were not able to get the treatment they needed. As you know, doctors who are training now, they don't know how to work in paper. So if system goes down, what are you going to do, right? So,
10 years ago when I was in training, we had a couple of clinics that still on paper. And now it's rare to see them, but there still are existing, which is also crazy.
Right.
How are you keeping all those records, right? And then when things happen to that clinic, what are you going to do? How do you pull the right information? And all the technologies start happening of analyzing all this data, right? Giving summary report so then we can get to the decision faster, right? Even from a consultant standpoint, when I have to go talk to a patient to decide whether they need heart surgery, I need to read their labs, their imagings, and half the time when they transfer from different hospital to us, I have nothing to look at. And if we have to request more data repeat imaging, that is costing on the hospital and the patient, right? So I think there's a lot of different areas that we can do things better. It's still go back to the management and operational thing of what does that workflow looks like? And how do we be in the trenches of creating some better systems and it doesn't feel like labor to us, right? Now the challenge is there's too many different systems out there, too many EHRs, and learning curve is different from different hospital. I actually fly around the different country, like I do a bit of travel work because CT surgery is need. Now I have to learn all these systems. How can we eventually get to a point that we don't have to feel like rigid? And how do we integrate all that into something more seamless?
Well, here's part of the challenge there. You've got innovation in software is going to happen forever.
Correct.
Right?
Yeah.
AI is going to be a very big wave as we start to figure out how to consume it properly. So I think ultimately you're going to see intelligent systems help do the integration automatically in the back end by knowing the different sources of data or process and make it simpler for the clinician. So that will be, I think, progress. I think on the risk side and the cybersecurity side, it's about finding ways to automate the manual tasks and require a higher level of available data on risk that makes it easier to collect it all, make sense of it, and actually have a security program that you can strategically line up and then tactically go out and execute against. So that's really where some of the regulations this year, right? The HIPAA NPRM is tightening the standards because they've recognized that the standards have been too low and they haven't been followed anyway. And so, the Change Healthcare attack last year was sort of a big wake-up call because it was the one event that touched 30% of the healthcare providers in the United States who couldn't get their bills paid. Right? And that's kind of the systemic risk angle. But each one of those entities every day has patient data they are in care of. They have staff members working in their practices. They're using an EMR, NextGen, or some other platform. People are leaving and going their practice. Do they still have access to these systems? How are they managing that? What kind of email are you using? Are you using Gmail? Please don't, right? So all these factors, it's so easy in the daily operation to have certain risks that are there. And these are the ones that the attackers have gotten very good at exploiting. It's actually a business where a cyber attacker will take some technology and share it in the dark web for a cut of the ransomware. So, it's spreading.
Yeah, I remember last year I was practicing at a hospital in St. Louis. One of the hospital completely got shut down. And their phones off, their entire system is off, and now they have to ship all their patients to us. Good thing we're close by, right? But you think about the entire infrastructure of a big hospital just shut down for the day, and
serious,
actually, it's very serious. What are you going to do for the patients already in house? And then perhaps we just have triaging. How do you get all those people to a different hospital to arrange that? That's the seriousness of these critical patients, and then even moving them is dangerous.
So then you ask, why aren't they doing more? And I'll use your cardiology example, right? How many patients that you see after heart attack exercise, eat well, right? Did they do it before? No, it took the heart attack to get them to realize they had to do something. It's the same thing.
Right. Unfortunately, that's human, right? Like we somehow only learn when we have to hit a wall. And I'm always a big component about building business, leading changes. How come we don't do it in a way to not put ourselves into the pressure of hitting that wall, to do it some more proactively? But proactive means what? We have to learn about ourselves, learn about the systems, have the aware about and honesty and authentic side.
Candor, yes.
Candorness to say, okay,
we have
fine.
to do this.
We have to do this. And I'm okay to open up some of the book and don't feel like, oh my God, someone else is looking at me, like become self-conscious. Instead, this is a growth path. It's a journey that we have to be on. And it's not about, picking you apart or analyzing you. It's actually if we don't understand how you function during stressful situation, how do you prevent that?
It's a very good insight, because that's where a lot of leadership has so many things on their plate. They're looking to they just want to get it off their plate and move on, versus say, to your point, because one of the things we do, we have to help them practice if something bad happens, so that the team gets muscle memory and knows if something goes down, what do you do first, second, third, and why? And you'd be amazed at how many people don't do that. Another thing we do, people call penetration testing, but really we are simulating a cyber attack to find the weaknesses, right? And I've been in 1,000 discussions where the CFO or the CISO is going to say, I don't want to test 10 things, I want to test 5. But the 10 are the ones you need to test. So testing the 5, you hope they don't go there. What about the other 5? Right? It's like a big health systems when they have like 100 medical offices. You actually have to security risk assess all 100. I'll sample. Well, the hackers don't choose the ones to attack based on the ones you did, right? So these are all examples of what you just said, which is realizing candidly, you know what? We have these vulnerabilities. We have to do something about it. Let's find a way to do it with more efficiency. There's a lot of scale. We have automation. Others have automation. Good people who understand cybersecurity and healthcare business, they can make the right strategic choices. It's available. You just have to make it a priority.
And sometimes that's, at the end of the day, why people hire people like us to just pinpoint the right thing, right? And then they can say, oh, that's all you did? Well, I had to take all my time to look into it, to know what to pinpoint. It's not to say, oh, this is that simple. Nothing is simple, right? Knowing, like, you guys have the expertise in cybersecurity and figuring out how you test it in a way that will give them a plan, a contingency, so they're protected. The same thing is like, we all at the end of the day can't do 10,000 things, but how do we set priority is have that honest reflection and doesn't have the false belief of we're slowing down to do this. This will actually help us speed up our growth, speed up the impact, speed up the care that we can provide. And be able to have that mindset shift is so critical in really any of us could move forward. as we know, there's the ups and downs of a business or adoption in that sense. We also like to ask the fun question. If
Here we go.
if we give you a magic wand that will grant you 3 wishes.
3 wishes, okay.
What would you use the wishes for to continue to help a health catalyst to grow?
I would actually use one of those wishes to come up with, for the smaller medical practices and hospitals, a common secure architecture where they could put all their systems in and kind of set a baseline that is sort of, I don't want to call it a nonprofit baseline, but make it a simple cost plus baseline. Because if you could just harmonize that and make it easy for a 5-doc practice in the middle of Iowa to say, oh, my EMR is now inside of this high trust certified cloud environment. I have already pre-configured identity management and multi-factor authentication. I have a secure email system that's part of a package. You'd solve a lot of problems just by that. So that would be the one that isn't about our company growth. It's about a strategic way to make the solution easier to be achieved, because that's really, it's kind of the problem right now is if everyone has to make a decision how to do it themselves, they don't have the talent to do that. The unit cost is higher. So if you can come up with a standard reference architecture, you can put in a high trust certified cloud. You can have your variety of EMRs. There's 100 of them. Have them in there, and have them all be then subject to the same security regulations. Have a standard multi-factor identity proofing system set up. Have secure email, secure messaging, revenue cycle management. There you go.
Simple.
Oh, simple. Simple, not so simple.
Right, and I think that the way of healthcare is like we have ideas, we have things, and now at the end of the day is how do we put the solutions together? What's existing? What's the gap? And how can we create these separate channels that will be able to continue to expand because there's a need, right? And at the end of the day, some of us know there is a problem, some people don't. And it's then for you as the expert to show people how to get to the buy-in. Do you see what's the most common challenges when you talk to people about these things where they have to hold themselves back, where they're like, oh, I kind of understand, but it's not me, or it's not our priority?
I would say the biggest challenge there, I'll call it satisficing. You know what I mean when I say that? It's sort of cognitive dissonance reduction. They claim to be solving the problem. It makes them feel better, but they're only doing like 10% of it. Oh, here's a list of 5 things you really need to do. You know, I'll pick 2. Yeah, it's okay. It's really not okay. And so really, because it's hard. It's hard, it takes time. While money is part of it, and we provide the talent if they can't hire it, but that's fine. I actually happen to believe it's about organizational involvement. Here's the other thing, that if you're in charge of security in a healthcare organization, it can be a very lonely job because everybody thinks it's your problem. No, it's actually their problem, right? And a lot of what happens in these, especially large organizations, is there's this thing called an exception. So if I'm the chief information security officer and I say everyone's got to have their laptop updated by security updates within 24 hours, but the head of cardiology says, well, I'm special, I want it done once a month. That's an exception. Well, those accumulate. So one of the things we actually do for people is help them put all that in a very, Sunshine has a way of getting collaboration, right? But a lot of the people we deal with are kind of exhausted at the thought of the process. So that's where helping them push through that with some automation, but strategy, and reminding the entire leadership team that it is a collective responsibility, not the person who's got security across their forehead. That's a big deal. That's a big thing what we do.
Right. It's title does matter, but it's recognizing it's not just one person's job.
Yes.
It's a collective of everybody embody it.
Exactly.
So one of the things we talk about a lot as a culture of any company to make sure that's sustainable and scalable and growth is that when you identify the mission and core of this company, everyone need to buy into it. So you can ask for a custodian worker, what is it that you do for this company? Their answer is tied back to the core of the business or the core solution. And therefore, everyone is embodied. It's no longer, this is not in my job description, right? Those people should not be in your organization to start with. We need to have the incentive to hire and move people in the roles where they simply just embody what we all believe in and take on security, quality, how we create impact, how we create solutions, all in the same level. It's not just, I don't do this job, but my job does involve every aspect of this organization.
But that takes a security leader who understands it's not a technical challenge. It's a collaboration communication challenge.
It's a human challenge.
Yes,
it's
exactly.
a behavior and culture challenge. And most of the time that's part of the slow hire and fast fire type of thing. But sometimes we also get into the battle of, I need that body to be there to do the work. But if they're not the right people, then one bad apple is still going to ruin the organization.
And I also think that in the case of this particular situation, a lot of people come up the progression, the career progression as technical people. A lot of technical people aren't as comfortable. In the social settings and in outreach. And as a leader, that's a big part of the responsibility. So they have to learn that, take some time. Or they don't think it's their job, which is worse because then they're going to get replaced.
Like having tough conversations.
Right?
It's tough for you, but you have to learn it so you can have more with others.
Exactly. As a CEO, I learned that a long time ago.
Not fun, but we got to do it.
That's right.
And sometimes, what I find is good is when I start having issues with even advisor level, now I redirect the conversation. And I think because of that, they start understanding if they cannot match it, then they can exit, And that is good. Like there's no harm in that. It's people are not on the right path. You're on the right path from brief period. That's fine. Then give yourself and the organization contingency and saying, I would like to have something better or different. And if we cannot make a lateral shift, then give all of us time to find the right people. And I think at the end of the day, whether you're dealing with security operations or human individuals, be a human in that conversation. We can all support each other in that.
You can, even if it's bad news. But I think what you're also saying indirectly is the rest of the organization is looking at you and they're saying, if you're going to tolerate a bad situation but expect me not to do that, how can I believe that when I don't see you having the kind of discipline to realize that you have to be even-handed, right? That's a corrosive culture that grows that way.
Correct. Despite that we don't think people are watching, they're always watching.
And they watch your actions, not what you say.
Now, how can we as a community support you? Just simply get the more words out there, be more aware. What would be the most helpful?
Yeah, I would say just, whether it's us or anyone else, just pay attention to doing a proper risk management, getting your house in order. And, we have automation systems, reach out to us. There are a lot of good people doing the work, but it's really, don't just say, I'm going to do the least amount possible. Actually think about it and be more diligent.
Amazing. So appreciate it for those of you guys are thinking about cybersecurity, the scare from last year versus you're already on the path of understanding what it means to protect your organization, your patients, whether it's a small practice ACO model versus health system. Connect with George, and for more information, go to their website. And at the end of the day, even though technology is tech, but it's still human element behind it. It's all about supporting you on how you function better as a leader, dealing with patients, your whole team, and the whole system together.
Exactly. Thank you. It's a pleasure.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.